My name is Edith Bracho-Sanchez. I'm a primary care pediatrician up the street at Washington Heights at Columbia University. I have the honor and pleasure of caring for the cab drivers of this city, the bodega owners of this city, the bus drivers of this city, the people that keep us going. Those are my people. Those are who I care for every day. I'm also a communicator. I'm a medical journalist. I work very closely with media. They know where to find me when they need someone to tell them what's going on the ground. I have created programs that ensure access to our community, the Latino community of this city. And I feel like that panel just now set us up perfectly for the conversation that we are about to have next. So it is really a pleasure to introduce Nancy Easton. She is the founder and executive director of Wellness in the Schools. Not only did she start something, which I always admire, really, truly, people that start something, it takes a lot of guts to start things. She has led this national nonprofit with the vision to ensure access to nourishing food and active play in public schools to really what has been tremendous growth. Nancy and her team have cooked more than 50 million school meals and led more than 85,000 hours of active play. Not only has she done all of this on the ground, she has also become an advocate for this cause. She has received numerous honors. It is really such a pleasure to introduce you. Nancy, come on up.
I'm not talking about sex in schools, just in case you're wondering. Sorry.
Okay, all right.
That was amazing, by the way. Oh my gosh, thank you guys.
No, I'm so excited to have this conversation with you. So,
I have my notes.
Nancy, I'm actually going to ask you something that I didn't put in the notes, just to start, because I really think, I mean, really, there's so many of us in such important positions within our organizations in this room this morning, and I think there's a lot that we're going to say that will hopefully resonate, just like this last panel gave us just so much to work with and think about, right? But I think, you know, when people walk away, they remember the personal, the people, really the people that they met, right? So Nancy, why? This is personal. What you started, the organization that you have started, that you have led, that you have grown for 20 years, feels personal. I imagine it is personal. Why?
You're right. You weren't going to ask that question, but I do have the answer. I've been doing this a long time. Although the last panel actually triggered something in me that I just will share also. The quick answer is, I was a teacher and educator in the Lower East Side of Manhattan when it wasn't the fancy Lower East Side that is now. I saw firsthand the impact of poor diet and lack of physical activity on children's ability to learn, right? And it was in a community, you know, in particular communities, right? There are public schools all over the city. Yeah. I also grew up in Miami, Florida, and I actually wrote, if you want to learn more about it, I wrote a chapter in Food Inc., in the book Food Inc. It's the companion novel to the movie Food Inc., where I talk about my upbringing. And hearing Dr. Lopez speak earlier, I saw redlining as a child in Miami. During the 1984 racial riots, I was in high school. I know. I know I don't look that old, but I was. And my best friends, who were my track teammates, they closed school, like, yay, we're not in school today. I was out water skiing. My best friends were across the water. Their homes were burning down. And I saw that. I didn't get it. I didn't understand that everyone was happy that we weren't in school. But that the people who were my best friends, what separated us was our skin color for sure in this body of water. So at a young age, I talk about food justice all the time, but it's social justice first, right? So thank you for triggering that memory, not such a great memory in me. But that is why I do this. I didn't understand then. I still don't understand now. I mean, we obviously understand more now. But why there were such differences among myself and my friends.
Yeah. I'm always fascinated by those early experiences and what they trigger in you,
Yeah.
right? So I want to ask you, and keeping it within the personal, right? When I treat patients on the ground up in Washington Heights, I get to witness firsthand what happens when families don't know where their next meal is coming from, when they sort of run out of money and run out of food before it's the end of the month, and those SNAP benefits are kicking in, right? So I get to see not only the stress, but also what happens to educational outcomes. It's really hard to focus. It's really hard to address mental health when you're not fed. You have seen this and you have addressed it with your organization. I wonder if we can take a step back and talk about policies, because I imagine you've partnered far and wide. And what I want to know now is, in all that you have done and learned and partners that you have worked with, what do you think would make a difference in making what you do and the solutions that you bring policy?
Well, first of all, thank you for your amazing work. You probably also see the school cooks and the children who I serve, of course.
Yeah.
And my quick answer is that we replicate you and all of your work, and then
Right back at you.
Where's
We
the
just
funding?
replicate each other.
So the very quick, easy solution, and I do not want to sound at all naive, although. When you said I started something 20 years ago, I always say that it was 99% naivete. Right? I've learned as I've gone, and I don't want to sound naive when I say this, or too idealistic, but I do think that we have to invest in our public schools if we're going to change at all. We have to invest. It is a system that's in place in this country, one of the few where children can go and learn and then hopefully earn. You can go for free. I know it's riddled with disparities, and there's schools on the Upper West Side and the schools on the Lower East Side and there's schools, but it is a system that we have in place that is funded by our government. We have to take advantage of those systems. We have to take advantage is the wrong word. We have to build those systems and invest in those systems. So that's my quick solution, is that we work in schools. I work in schools. It's why I do what I do. And we were intentional about doing this work in schools because it's a place of access and a place, again, I don't want to say this lightly, but of equity, right? Because children can go to school for free. Then that's the theory. So you ask about policy, what's the reality? And my work, so you say the child doesn't know where her next or his next meal is. Actually, in theory, school can be a place for their next meal, for breakfast, for lunch, for dinner, for snack. So for all of your meals. Many children get 50% of their calories at school. So we come in to say how to help school food service directors do this better. There are unbelievable, amazing humans out there. School cooks, for sure. Everybody learned about the school lunch heroes during the pandemic. They've been around for a long time before the pandemic. And the food service directors who are doing incredible work against all odds. And that's the piece that I definitely want to talk about. They are doing incredible work. Sorry, I'm not looking at you.
No. It's a conversation.
So a couple policies that do need, in my opinion, to be in place for schools to do a better job. One is universal school meals. And so school lunch is free. It's actually not free. You have to fill out a lunch form. So basically, when you fill out this cumbersome lunch form and you bring it back to your school, you're handing it in and saying, I'm poor, right? I'm poor because I'm a family of 4 and my family makes under $40,000 a year. Or I'm in the middle because I'm a family of 4, my family makes $55,000 a year, or I have to pay for lunch. So you go to the cafeteria, and it's full of, they call it social suicide sometimes, because basically there's the kids, there's the free lunch kids, everyone's heard about the free lunch kid, right? And that, if you had universal school meals, that goes away. Everybody gets lunch for free. And the problem is there are only 8 states in this country who have universal meals. There are many more states in this country. New York City, its own island, we have universal meals, even though our state doesn't. So important. We've seen so much change because of that. Kids come to school for food, and everyone comes, no matter what you look like, right? So universal meals are so important. And family incomes are volatile, as we know. So you may fill out that form in September where your family's making $41,000 or under $40,000, so you get free lunch. And then come 2 months later, you don't have that job or whatever else, and you can't afford that meal, but you're already stuck because they do the numbers in October, right? So universal meals, I believe, are incredibly important. So that's sort of access, right? And the second piece is quality. And, fast food processed food, and I may have to contradict the doctor. I'm not going to do that, but I do look at food as medicine, but I don't. Anyway, the access to healthy food, delicious, nutritious food, is not available because the cheap food is what is being subsidized by our government. So it really starts here and goes all the way here. So our work is really top down and bottom up. The three, and probably everyone knows this in this room, but the three most subsidized crops by our government at the tune of billions with a B are soy, corn, and wheat. And those aren't going to feed, well, they are feeding, they're basically making our Twinkies. They're making all of our processed food. So that's cheap, right? They're also going to feed our cows for meat and feedlots. So that's what's happening with these three crops that are subsidized by our government. Fruit and vegetables, don't quote me, I think it's 3% of government subsidies goes to local farmers, black farmers, family farmers. The rest go to these huge ag, and that's why it's so cheap. So right now, I lost my train of thought, but the next policy that I want to talk about is the Child Nutrition Reauthorization Act. That's what I want to go to. It's reauthorized every 5 years to give more money to food programs in this country. So WIC, school meals, right? Mm-hmm. The last time the Child Nutrition Reauthorization Act was reauthorized, and I do this always with my own children, my now college-bound child was 3, 2010.
Wow.
So we were advocating, I know, because I had him with me down in Washington, and we were trying to get 70 more cents per child so that we could buy better food, and we could cook meals from scratch in schools, because we know that's healthier. We know that processed food, I think all the doctors can agree with me, in our room is what is killing our country, right? So we were advocating for more money. We got 6 cents. We got something. But that was in 2010. It hasn't been reauthorized since.
Say the name of the act again.
The Child Nutrition Reauthorization. So it's providing the funding for nutrition programs in schools, and then so many bills are attached to it, right? I work, and by the way, so right now it's $1.25 for meals in schools. I challenge all of you to go out to New York in the streets right now and buy lunch for $1.25. What are you going to get? You're going to get crap. You're going to get the Twinkies, right?
Slice of pizza.
So how can you maybe I don't think you get a slice anymore.
Yeah, probably not.
So maybe you could anyway. How can you expect these school lunch heroes and school meals to be nutritious and delicious when you have $1.25? But they're doing it. They're doing it. And I do want to get to some of the work that we're doing. I know I'm rambling. I just want to say one more thing on this, I think, and I'm forgetting it. But I forgot what I was going to say.
It'll come back to you. It's okay. It'll come back to you. I do wonder. Again, you've partnered, you've grown. It came back to you.
It came back to me.
All right, go for it.
Do you mind?
No,
I'm older than you are, so I'll forget it. You'll remember.
I have it up here. Yeah. Go ahead.
Kind of like Carmen and Dr. Martez, right? Oh my gosh, $1.25 for child. Keep talking.
It's okay. It'll come back to you.
Wow, that was a moment.
So I do wonder.
Aren't there drugs out there for this? Someone have one?
You have created this program, and I definitely. So there's two parts to my question, right? Mm-hmm. How does your program work? Sort of like high level overview of how you've been able to partner, how you've been able to really, you have donors, make that money make a difference, right? Mm-hmm. So how does it work? Sort of high level overview. Mm-hmm. And then how do you scale it? So because, and we were talking, full disclosure, we were talking a little bit before this fireside chat, and you told me that you are at a place now, 20 years later, where you know how to scale these things. Yep. So it's a two-part question. High level overview of your program, and then what have you learned about scaling up?
Okay. I'm first going to tell you what I just remembered.
Sounds good.
I wanted to put in this plug, and I'm like, what was that plug? Attached to the CNR are other bills. The Obama administration put in CEP, which is Child Eligibility Programming for universal free meals. So you can attach bills, and I'm working with a wonderful group of school food service directors called Scratchworks to try to put more scratch cooking in schools. And they have a bill. We have a bill called the Scratch Cooked for Kids Act, or bill, that's being attached to whatever, the CNR or the Farm Bill. The Farm Bill is the bill that provides that dictates what we're funding, right? What farm crops, the soy, the wheat, and the corn. So anyway, I wanted to put in a plug for that bill. But So our program, at the highest level, our mission is to ensure access to nourishing food and active play for children in public schools. People are talking a lot today about partnership, and I know it's a big piece of this work. Everything we do is partnership, and I do feel proud to sort of lift our organization up as a strong public-private partnership. And I realize my privilege in saying that, and to being this sort of, small, relatively small nonprofit, that I'm privileged. I have the luxury to innovate, to think about new ideas, to bring this in, to come and talk here. Whereas I deal with huge bureaucracies who don't have that privilege. And so I think that's a huge piece of public-private partnership, but we partner all day long. So essentially our work, school districts come to us and ask us to help them meet their goals. Right, and I'm going to share with you about New York City and what I think is so replicable. But we do that through fitness programs and through food programs. Mm-hmm. And our biggest fitness program is with a company called Exos. I don't know if you're familiar. It's a Fortune 500 company, female-run, and they provide corporate wellness to people like you and your companies, to professional athletes. But they wanted us to help them to bring fitness to schools, and so they gave us in-kind dollars. They bring their coaches who are coaching, Michael Jordan and what are these quarterbacks' names? Mahomes, and anyway. They're coaching them and they're coming to our schools also. They're beamed in live, so live virtual. So it's not as if it's just, they're also taped, but they are, so that's a program, that's one of our programs. And we have so many programs, so I won't keep going on, but public-private partnership in many, many ways, through schools, through corporations, through our nonprofit. And I'll go a little bit more about that, because basically what we do there is we do movement breaks throughout the day, and we work on the recess yard with the existing recess aides to help them to get their kids moving. It's not about, most of the kids we work with are not being, shuttled off from their driver, because I live in New York City, right? So there's people shuttled off by their driver, and they're people that we serve, to their after-school fancy sports program. So in school, which is why we have to invest in schools, is where our kids are getting all this. So we want to make sure we optimize that time. So recess is a big time for us, and then movement breaks during the day. We have these fancy coaches coming in, and our coaches support that, but to do movement breaks, so 10, 15-minute movement breaks. This matters. This does matter. So, okay, what else do we do? So the big program that I definitely wanted to talk about today, some of the self-promoting, is our program called Chefs in the Schools with New York City. And for 20 years now, we've been partnering, again, back to partnership, with chefs who've helped us to design recipes and who've helped us to train cooks, who've helped us to build gardens in schools. And it's seen many different versions. We're around the country doing what we call a cook camp, where we're training school cooks to cook meals from scratch, and then follow up with them in programming. And then in New York City, because we want the program to be equitable, I know, throwing out these words, but there are 1,200 school buildings in New York City. So you can't, let's do one little cute program on the Upper West Side. No. There are 1,200 school buildings from the Bronx to Staten Island. There are 1,800 schools, because there's so many shared spaces. So this program was designed, the city came to us, and that's how we do our work. Everyone's talking about working from the ground. They know what they want and they need. They wanted recipes that were more scratch-cooked, culturally inclusive, and plant-forward. They asked us to help them do that. So we put together a chef council, and that's how I came here today. Chef Grace Ramirez invited me. She's one of our chefs. She created a sofrito rice for the menus. Rachel Ray is our chair. So, of course, there's celebrity chefs, but also chefs like you and me developing recipes. So on the New York City school lunch menu, just last week, I had a sweet potato macaroni and cheese. I had a jollof cauliflower. I had a pineapple, you don't call it fried, but fried rice, unfried rice. A kelewele plantain. These are recipes on the menu we had 10 chefs. They each had to give 10 recipes.
I love that.
And so they are now, and then the second piece of the program is we hired chefs, 60 chefs who are rotating through in 2 years, all 600 schools. They have 10 schools each, to train the cooks. Because you can't just say to a school cook who's probably never trained or comes to her job or his job not well skilled for the job, and not supported. And we come in and we teach them. You can't just say, here, go make the kelewele plantain. So we teach them how to prepare these recipes. We teach them preparing in advance. We teach them storage and organization. We teach them batch cooking. But most importantly, and I think, well, equally as important and most important, we teach them the why of this work. We teach them why we do all of this. And I can tell you, I've never sold our program as a workforce development program, but it really, I see these cooks come into training, kind of like another day of training, you know, long day. I mean, they've got long days with kids, and they leave so inspired, and it's so exciting. So that program, there's 60 cooks rotating through. This last year was 600 schools. Next year will be 600 more schools. They want us for more than a month, I can tell you that. And then there are 15 chefs. We have 75 chefs who are doing education programming around that. The children in their classrooms are making the pineapple fried rice, the jollof cauliflower. They say, this is delicious. And we say, well, guess what? It's in your cafeteria tomorrow. So that's just a 30-school pilot. I know I was damning pilots a minute ago, but we didn't have the resources to be in all 1,200 schools for the education program. So that's the program that thank you for allowing me to talk about, because we're really excited about it.
And I love it, and it's such a multi-pronged approach, which is so important, right? It's like, it's the cultural relevancy, it's the partnerships, it's the workforce development. Really quickly, because we only have a couple of minutes, and I love that. No. Oh my gosh, it's fascinating. Everything you're talking about is so fascinating and speaks to my soul. And I love that you've partnered with chefs, and Grace couldn't be here, but Chef Grace Ramirez, amazing. Also someone who's partnered far and wide. Now, how do you scale it up? This is, and we only have a couple of minutes, and I know that we could have a whole nother panel altogether about scaling up these solutions, but how do you scale it up? And for people who are in the audience who are maybe looking to make an investment, right, to say, you know, maybe my company can support a child being fed so that a child can learn and thrive and have good access to healthcare and better health outcomes, I should say. So for someone who's really saying, you know, how do I make an investment? How do you scale up? And where can they make a difference, really?
And I want to say something else, too, about the chef partnerships, because I don't want this to come across as like, oh, cute, chefs go to school and make a difference. You really have to think about how to leverage your partners, right? We have the chefs develop the recipes. Those are the fancy chefs, right? And then chefs who get paid by us are coming every single day, and the hourly that we are paying them is more than they're making in restaurants. So it's and it's funded by the city. So it's thoughtful. It's systems change, right? You can't, you know, people are sort of poo-poo the Michelle Obama chefs move to schools, and yeah, if a chef's going to go and build a garden and leave, that could be worth poo-pooing. But if you think the way we think through our programs is really to systematize something. So just quickly on scaling. Because it's been working now, they're on our second year. I know that second year doesn't mean totally working, but it's working, and we're working out the glitches. The first year of the program was actually privately funded, and it's a model that I talk about a lot, because sometimes, you know, a city's not going to buy you if you don't have sort of evidence that it can work. So the first year, we were funded by New York Health Foundation and a local philanthropist to prepare, to hire, to get all these chefs on board, to improve our training program. And then the second year, the city funding kicked in. And when we talk about public-private partnership, I think it's a really important model. I mean, if there are donors in the room, you don't want to just keep giving forever, although you can. But to know that a city might kick in, and city dollars, although I know we think there's no money, they're bigger than private dollars often. So I think that in terms of scaling budget-wise, that's important. And in terms of scaling, just in terms of program, again, we've been doing this for 20 years and have so many different models. This model is one that I know that I can walk into a new city tomorrow, and I don't mean to sound so confident, and be able to do it again.
Confidently.
Walk into a new city tomorrow.
She can walk into a new
Mostly
city
because there's
tomorrow
so
and
many change.
this.
Well, there's so many change agents out there. These chefs, the team I work with. First of all, they're representational of the communities we work in. They look like the kids who are eating our food, and that's so important. They're so passionate and so amazing they're so passionate about their work, and so skilled. I mean, I learn something every day from these chefs. So I know they're out there, and I know we can scale. I know you're looking at the clock. Sorry.
No, and we just learned a lot from you. Thank you so much.